Hi guys, welcome to gross anatomy of the abdomen. So today we're going to talk about lymphatic drainage of the anterolateral abdominal wall, what you need to understand, and its clinical significance. Right, so here you see that let me start by actually assessing the plane that transect the umbilicus is called what? Transumbilical plane. And we say it is between L3 and L4. So first of all, you have to understand, we draw a plane right here, the transumbilical plane. The region that is above the transumbilical plane is called the supraumbilical region. The region that is below the transumbilical plane is going to be called the infraumbilical region. All right. So the supraumbilical region is going to drain, its lymph is going to drain into the axillary lymph nodes, especially the anterior axillary lymph node. So remember, we have 5 axillary lymph nodes. We have the anterior, the posterior, the central, the apical, as well as the infraclavicular lymph nodes. Right. So the supraumbilical region drains into this. So most of the lymph drains into this portion, but we also have some lymph of the supraumbilical region draining into the parasternal nodes or your internal thoracic nodes, draining here. Good. Right. And then the skin of the back. The skin of the back above the iliac crest will actually drain into the posterior axillary nodes. You understand? Good. And then let's look at the infraumbilical region, this region. So remember, we have what's called an inguinal ligament, and we have some lymph vessels that are parallel to this inguinal ligament. These are called superficial inguinal lymph nodes. These are later divided into medial and vertical, right? Medial and and medial and lateral, right? And then the medial are classified as horizontal and vertical, as we're gonna see. So in the infraumbilical region, the lymph drains into the superficial inguinal lymph nodes, right? As well as the skin below the iliac crest, which is the skin of your buttocks. The lymph from the skin of the buttocks will also drain into the superficial inguinal lymph nodes. Right. So let's take a look at another diagram. Right. So you can actually see these are your axillary lymph nodes. This is your transumbilical plane. Above the transumbilical plane, most of the lymph drains into the axillary lymph nodes, and some actually drains in the parasternal lymph nodes, like I have said. In the infraumbilical region, you have a lymph draining into the superficial inguinal lymph nodes, right? To the back, we make a demarcation based on the iliac crest. So above the iliac crest, the skin will drain into the axillary lymph node, specifically to the posterior axillary lymph node, and then to the below the iliac crest, which is the skin of your buttocks, will drain into the superficial inguinal lymph nodes. Good, right? So this is very important because you'll be able to know, especially in conditions where there is cancer, you'll be able to trace the origin of the disease based on these lymphatic system drainage. Right, so that's everything that I have for you today. Take care.